Are you a new mom that is experiencing the symptoms of mood swings, difficulty in sleeping, anxiety, and stress? If you've answered yes, then stick around because I will be discussing the differences between what baby blues are and what postpartum depression is. So let's get right into today's video. Most new moms go through the baby blues, which is a range of emotions including mood swings, stress, anxiety, and even excessive crying. These symptoms appear 2 to 3 days after delivery and subside most likely after 2 to 3 weeks. But if these symptoms don't subside, the next stage is what we call postpartum depression, where the symptoms worsen. You might see yourself have excessive amount of anxiety, stress, worry about how you're parenting, not feeling good enough to take care of your child. Postpartum depression may be confused with the symptoms of the baby blues, but the symptoms in postpartum depression are more intense and last a longer time. Now, these symptoms can appear during your pregnancy and can also be seen to occur a year after birth. Some of these symptoms include depressive moods and severe mood swings, crying too much, having a difficulty bonding with your baby, not being able to have fun in activities that you enjoyed before, withdrawing from family and friends. You will have either a loss of appetite or you might eat more. You might see yourself sleeping more or you might be sleeping less. These leads to the feelings of having inadequacies within one's self, causing the individual to feel worthless, shame, and guilt. And this leads to the feeling of hopelessness. Once the individual starts to feel hopelessness, they will have feelings of severe anxiety and panic attacks. They'll start to feel restless. They might have thoughts of harming themselves and the baby, and this results in recurring thoughts of suicide. There is no single cause attributed to the development of postpartum depression, but some of the causes include genetics, physical changes in your body, and emotional responses after birth. Now, genetics would mean that if somebody in your family has had postpartum depression before, then there is a high risk that you as a new mother can develop postpartum depression. Physical changes in your body include a drop in the hormones such as estrogen and progesterone may cause a number of changes in your body. The thyroid gland can get affected as well and may make you feel sluggish, tired, and depressed. Emotional issues cause you to feel as if you're not a good mother, may make you feel inadequate and create that feeling of hopelessness. Any new mom can develop postpartum depression after the birth of any child, not just the first. Here are some of the risk factors that you need to be aware of. You had depression either during pregnancy or even before it. You experienced postpartum depression after pregnancy. You have a history of depression and mood disorders in your family. You went through stressful life events such as a complicated pregnancy, job loss, or illness. You had trouble breastfeeding. Maybe your child had health issues. You have a weak support system. You might have financial issues, and maybe the pregnancy was unwanted. If you're liking this video so far, give me a thumbs up and subscribe to my channel for more videos on parenting. Left untreated, postpartum depression can interfere with the bonding of the mother and child and can affect the whole family. For mothers, if the symptoms are not treated in a proper way, it can lead to them having an intense and severe amount of symptom lasting for a very long time. It is important to get help when you notice that the symptoms are getting more intense in nature. For the other parent, it is important to note that not only the mothers but the other parent can also have a risk of developing depression because they're seeing their partner go through something so intense. And for the children, it can cause emotional and behavioral problems due to the lack of the mother and child bonding, resulting in excessive crying and maybe having sleeping and eating difficulties, and it can also lead to a developmental delay in language. Your healthcare provider will ask you to specify the symptoms that you're going through to understand if you're either going through baby blues or have the symptoms become intense enough to classify you as having postpartum depression. They will make you go through a depressive screening and other tests to eliminate any other underlying medical conditions. Treatment and recovery time for depression may vary depending upon your intensity of symptoms. The first and foremost care that your healthcare professional will perform is if you have an underactive thyroid by prescribing you medications. And then they may also refer you to a mental health professional. For a mom that has been going through baby blues, some of the recommended treatment options include having adequate time of rest, accepting help from your family and friends, indulging in self-care activities so that you remember who you are, joining a new parents group so that you see that you're not the only one going through similar things, and exchanging ideas from other moms on what they did to overcome the baby blues. Postpartum depression is often treated with psychotherapy or medications or combination of both. Under psychotherapy, you will have your mental health professional use cognitive behavior therapy, which is a form of therapy which goes exploring your thoughts, emotions, and feelings and how they're interconnected to each other. Realistic goals will be set, your thought patterns will be assessed, and you will be given strategies where you will start to counteract those negative thoughts. Another form of modality that is used is interpersonal therapy, where your mental health counselor may just chit-chat with you and understand what changes you have gone through before pregnancy and after pregnancy and how they're affecting you. Medications are also given during postpartum depression recovery mode. Now, it is important to note that any medication you take for depression will go into your breast milk. So talk to your provider and figure out what is the best option for you. Now, my hope with this video was that you understood the difference between baby blues and postpartum depression. It is absolutely critical and important that you reach out to loved ones, your healthcare provider, and even a mental health professional if you see your symptoms getting more intense and worse in nature. Come back here next week because I will be discussing the various parenting styles, and who knows, you might recognize yours in there as well. I look forward to seeing you here next Friday. Have yourself a wonderful weekend.